Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to discuss fatigue as a symptom of the coronavirus. Fatigue is one of the CDC's 11 symptoms of the coronavirus. Now many individuals have or will have experienced the coronavirus as a short-term illness. Now during the period of infection, the body tends to feel fatigued as your immune system is busy combating this virus. But something interesting is being noted once this virus passes. Now, there are individuals complaining that the symptom of fatigue still persists even after having tested negative for the virus. There's evidence that's emerging that a significant minority is struggling with fatigue long after their encounter with this virus. Let's get a general understanding as to what fatigue is. Now, fatigue is defined as a feeling of overtired with low energy and a strong desire to sleep, which would interfere with their normal daily activities. Whereas in this case, extreme tiredness as a result of an illness. Now, with regard to the coronavirus, studies have shown that fatigue is one of the top 3 symptoms reported among confirmed cases. This symptom is among those of cough and fever. Now, we have to keep in mind that fatigue can be a symptom of a number of disorders, not just COVID-19. So it is important to understand that there are different types of fatigue, such as physical fatigue, of course, which can be a result of strenuous activity, or mental fatigue as a result of job-related work, a good example being working without taking breaks and beyond the hours in which you were hired for. And then there's emotional fatigue, which occurs as a result of too much worry, which in Chinese medicine can obstruct the functions of the spleen. So when thinking of COVID-19, keep an eye out for accompanying symptoms such as, let's say, cough, fever, tightness of the chest, body aches, etc. Whereas I would then recommend you contact your physician to be tested for COVID-19. Now, when it comes to traditional Chinese medicine, clinical manifestations of fatigue can be diagnosed as either consumptive deficiency, painful obstruction syndrome, insomnia, and headache. Fatigue can be diagnosed under 5 basic patterns in Chinese medicine, which are exterior pathogenic invasion with existing deficiency, where there would be fatigue, of course, with fever and slight aversion to cold, sore throat, headache with body ache, and swollen lymph nodes. Notice how some of these symptoms mirror that of COVID-19. Now, the individual's tongue would present with a thin coating and a pulse that would be soft. Now, in a case such as this, I would look to nourish the righteous qi, disperse wind, and expel exterior pathogens. Another pattern of fatigue in Chinese medicine could be as a result of spleen deficiency with liver qi stagnation. Here, an individual would present with fatigue, body aches, depression, insomnia with poor memory, poor appetite, and abdominal distension. There would be a pale tongue coating and a thready pulse. Now, in this case, I would look to calm the liver, regulate the flow of qi, and strengthen the spleen. Now, another pattern could be heart and spleen deficiency, whereby an individual would present with a pale complexion with fatigue. There would be a lack of strength, shortness of breath, dream-disturbed sleep, poor appetite with loose stools. Now, the tongue would present as pale and the pulse would be weak. In this case, I would look to nourish qi and blood, strengthen the spleen, and enhance the functions of the heart. Another could be spleen qi deficiency, whereas there would be, again, fatigue, muscle soreness, shortness of breath, with headache accompanied with dizziness, and the tongue would be pale with a thin white coating, and the pulse would be weak. In this case, I would look to tonify qi. Another pattern could be liver and kidney essence deficiency, where an individual would present with weakness, fatigue, lower back pain, knee pain, an empty headache with night sweats, dry mouth, and sore throat. The tongue would appear as red, and the pulse would be rapid. In this case, I would look to tonify kidney and liver and nourish the yin and essence. Now, when it comes to treating fatigue as an acupuncturist, I would do little in the way of recommending herbal formulas. That's just me. I'm noticing that some of my COVID-19 patients who've come to me after so-called recovering from the virus, but still feeling fatigued, I would administer acupuncture alone with great success. To this point, I've heard from all of the patients presently under my care for post-COVID-19 fatigue, and they're noticing great improvement in their energy levels, and they're also sleeping much better. So along with seeing your physician, I recommend you also see your local acupuncturist if you're experiencing symptoms of fatigue after having been infected with the coronavirus. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?